All right, here we go. Question number 6. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will what? Will they tire easily? Will they grow normally? Do they need more calories? Or will they be more susceptible to viral infections? What are we thinking? But the answer is A. All right, it tires easily. The toddler with a ventricular septal defect will tire easily. The hole, which is the defect, occurs in the wall, which is the septum, that separates the heart's lower chambers, the ventricles, and allows blood to pass from the left to the right side of the heart. All right, the oxygen-rich blood then gets pumped back into the lungs, instead out to the body, causing the heart to work harder. Okay. That's what it does. That's actually part of physiological adaptation, all right, which is the third largest section on the NCLEX exam at 11 to 17%. All right. Here we go. Question number 7. The nurse is monitoring a client with a history of stillborn infants. All right. The nurse is aware that a non-stress test will be ordered for this client to what? Determine lung maturity, measure the fetal activity, show the effect of contractions on fetal heart rate, or measure the well-being of the fetus. What are we thinking? The answer is B, measure the fetal activity. A non-stress test determines periodic movement of the fetus. Anybody that's a part of my NCLEX course knows that I just went over maternal health, and I just went over this the other day. So just saying, reduction of risk potential, which is 9 to 15% on the NCLEX. All right. I want to be an LPN. Okay. What are you doing what actionable steps are you doing to make that happen? Number 8, the nurse is evaluating the client who was admitted 8 hours ago for the induction of labor. The following graph is noted on the monitor. Which action should be taken first? Is it A, instruct the client to push, perform a vaginal exam, turn off the Pitocin, or place the client in a semi-Fowler's position? What are we thinking? And our answer is C, turn off the Pitocin. The monitor indicates variable decelerations caused by cord compression. All right, if Pitocin is infusing, the nurse should turn off the Pitocin. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX. Question number 9, the nurse notes that the following on the ECG monitor. The nurse would evaluate the cardiac arrhythmia as what? Is it a flutter, a sinus rhythm, a VTAC, or is it AFib? What are we thinking? But the answer is C, it's ventricular tachycardia. That's what it indicates, all right? And that's part of reduction of risk potential. Question number 10, the client with clotting disorder has an order to continue Lovenox, which is enoxaparin injections, after discharge. The nurse should teach the client that Lovenox injection should be what? So what is Lovenox? What is it? What does it do? All right. And then what do I want to teach the client about when I'm injecting this medication, or when they're injecting this medication? Is it to be injected into the deltoid muscle, into the abdomen, aspirate after the injection, or clear the air from the syringe before injections? What are we thinking? The answer is B, be injected into the abdomen. Lovenox is a part of pharmacological and parenteral therapies, which is which is the second largest section on the NCLEX at 13 to 19%.